the common problems what I as a gastroenterologist have seen here include diseases related to acidity, including gastroesophageal reflux disease, ulcers of the stomach and the duodenum, resulting in bleeding and pain and vomiting and things like those, and other disorders also like carcinoma of the stomach and lymphoma of the upper GI tract, which is less common. And other very common issue which I encounter here is H. pylori bacteria associated disorders, including ulcers, gastritis, many other symptoms including vomiting and bloating and dyspepsia and whatnot. So these are the disorders related to stomach which I commonly encounter here. Now I also see some cases of jaundice, that is disorders of the liver with due to diseases due to virus, including acute and chronic viral hepatitis. Other liver disorders include cirrhosis of the liver with or without bleeding, and as you know, cirrhosis can cause other complications like ascites, that is fluid collection inside the abdomen. Patient can have altered sensorium and sometimes has swelling of the limbs, and sometimes they come with bleeding, that is upper or lower gastrointestinal bleeding also. So we offer treatment for that also. Rarely I encounter pus collection, that is infection and inflammation with pus collection inside the liver, that is called liver abscess. And other liver and gallbladder disorders like gallstone related illnesses, that is a biliary colic, that is a pain due to a stone in the gallbladder, and if it is severe it can result in an inflammation and infection with the swelling of the gallbladder called cholecystitis. We offer treatment for those also, and sometimes the stone can get blockage of the biliary tract, resulting in a biliary obstruction with or without a pancreatitis. All these are diagnosed here and we offer treatment for them too. I have also seen patients with pancreatitis, and I think acute pancreatitis, that is inflammation of the pancreas, is possibly the most common patient admitted into the ward from a gastro side. Most common causes for pancreatic inflammation are alcohol or a stone in the biliary tract. Also, it might be related to hypercholesterolemia, that is one particular type of cholesterol called triglyceride. When it is high in the blood, that can result in pancreatitis. So that is another common admission in my ward, acute pancreatitis. Also, I encounter chronic pancreatitis, that is sometimes this pancreatitis lasts for many months, and these patients get collections over and around the pancreas and develop stones and all in the pancreas. So I encounter these kind of patients also. Now going on to colon, I have seen many patients with ulcerative colitis and Crohn's disease. These two are known as inflammatory bowel disease, which is also I think is increasing in incidence in Oman. And I encounter colonic malignancy, I think is one of the more common malignancies in males in Oman, rectal as well as colonic cancer. And sometimes I encounter diverticulitis, which is an inflammation of the type of inflammation of the colon. We offer treatment for all this. Now these are the common conditions I get in my OPD and in the emergency department. Now going on to endoscopy, in our unit here we have we offer diagnostic as well as therapeutic upper and lower GI endoscopies. Diagnostic means to diagnose a condition, that is, a patient comes with one particular set of symptoms and we do an upper or lower GI endoscopy to diagnose that condition. So there is no procedure involved in that, and at times patients come with problems like bleeding or things like that. So we also offer therapeutic endoscopy. Therapeutic endoscopy means that we are doing something with the scope. that is like control of bleeding with clipping or injection, or a banding in case of a cirrhotic portal hypertensive bleed. And in the case of colon, patient could be having colonic polyps, so we remove the polyps, that is called polypectomy. So these are some of the therapeutic procedures we do in Badr Al Samaa Al Khoud. Also another area is a bariatric endoscopy, where that is, bariatric means for weight loss in obese patients. So we offer a balloon therapy through the endoscope. A balloon we have for 6 months as well as for 12 months, and this is also been done in our branch. So these are some of the common cases we encounter, and facilities provided by endoscopy department in our hospital. Thank you.